Hello everyone, welcome back. Today we'll discuss about a man presented with severe headache. He is the MCQ. A 42-year-old man presents with an acute onset occipital headache that began 6 hours ago. He describes it as the worst pain he has ever had. On examination, he has photophobia, neck stiffness and vomited 3 times. He has no neurological deficits. His blood pressure is 130/80, heart rate is 85 per minute and respiratory rate is 16 per minute. Urgent non-contrast CT was performed and there is no evidence of an intracranial bleed. We asked about what is the most appropriate next step of management. Option A is reassure and discharge. B. Admit, observe and discharge the following day if symptoms improve. C. Administer nimodipine. D. Lumbar puncture for xanthochromia after 12 hours from onset of headache. E. Urgent lumbar puncture for microscopy, culture and sensitivities. Okay, before getting into the answer, I would like to show you guys how to do this MCQ. First, you must understand the important keywords here. What are the important keywords here? The words I have highlighted: an acute onset occipital headache, it's very important, and he describes it as the worst pain he has ever had. Worst pain he has ever had. Yeah, and he has photophobia, neck stiffness and vomited 3 times. So these are the features of meningeal irritation. And also we are saying as there is no neurological deficits. Okay, and the blood pressure, heart rate and respiratory rate are normal. Urgent CT, NCCT was performed and there is no evidence of an intracranial bleed. So we are asked about the most appropriate next step of management. So in a question like this, we are not given the diagnosis. So from the clinical scenario, you should come to a diagnosis. Usually in these exams that we are given a classical history. So from this history, what do you think is the diagnosis? Yeah, it's the subarachnoid hemorrhage, that is bleeding between your arachnoid and pia. So I'll give you the answer. The answer is lumbar puncture for xanthochromia after 12 hours from onset of headache. So why D is the answer? We'll discuss it now. So as I told you earlier, the diagnosis is subarachnoid hemorrhage and the photophobia, neck stiffness and vomiting are the signs of meningeal irritation. So in subarachnoid hemorrhage, non-contrast CT is the first line investigation that you should perform, but keep in mind that a normal CT, it does not rule out subarachnoid hemorrhage. This is the important point here. So this is a case scenario like a negative CT in subarachnoid hemorrhage. So obviously either you can perform MRI or a lumbar puncture. So we are not given the MRI as the option, and the LP for xanthochromia. Xanthochromia is a hemoglobin degradation product. We must do this after 12 hours from onset of the headache, because if it's performed within 6 to 12 hours, that means before 12 hours, the cerebrospinal fluid CSF is uniformly blood stained and our objective is not achieved. So we must perform it after 12 hours to 2 weeks. Usually after 12 hours of symptoms, and then the supernatant is xanthochromic, and the CSF can only be declared normal following spectrophotometric analysis for xanthochromia. And please keep in mind that lumbar puncture should not be performed if there are features of raised intracranial pressure or if there are any focal neurological signs. So I hope you understood the answer well. Coming back to the MCQ. Option A is reassure and discharge. Of course, we can't exclude subarachnoid hemorrhage with a negative NCCT. And admit, observe and discharge the following day if symptoms improve. No, we can't do that. We must rule out, we must exclude subarachnoid hemorrhage and admit nimodipine. Yeah, nimodipine is a part of the medical management of subarachnoid hemorrhage, but we are asked about the most appropriate next step of management. So the most appropriate next step of management is coming into a diagnosis whether it's subarachnoid hemorrhage or not. This is not the best answer here. An urgent lumbar puncture for microscopy and microscopy, culture and sensitivities? Of course not. This is done to exclude meningitis, but his vitals are stable and the man presents with an acute onset of headache. And we are not said as he is having fever, also we can't come to diagnosis that it is meningitis. So I hope you understood this MCQ well. So join with me in this process of MCQ discussion and we'll discuss important questions like this in the future. Please make sure you subscribe my YouTube channel and hit the bell icon so you will not miss a single video from me. That's all for today. We'll meet from another MCQ like this.